Welcome, everyone. I'm Dr. Linder. Today, we're going to be looking at the skeleton, but we're going to be focusing primarily on the axial skeleton. When we refer to the axial skeleton, you'll see what we have here in that orange, yellowish type of color, everything in the center, the skull, the spinal column, the sacrum, the coccyx, the sternum, the ribs, everything in the center is going to be the axial skeleton. And we have about 80 bones there. And then everything that is outside of that to the periphery, that's referred to as the appendicular skeleton. We have 126 bones there, giving us a total of 206 bones. So here's a little bit more of a breakdown. And I'm not going to ask you these. I'm not going to say how many cranial bones are there or how many facial bones, but just to give you an idea as to the breakdown, right? We have, if we focus on the axial, where we have 80 total, 24 of them are going to be the vertebrae, right? And that's because you have 7 cervicals, 12 thoracic, and 5 lumbar. And when you add those up, you get 24 freely movable vertebrae. And then 24 are the ribs, 24 ribs, because there's 12 thoracic vertebrae, and then the ribs are paired. So you have 12 on the left, 12 on the right. So we have a total of 24. So there alone, right, we're at 48 bones. We're more than halfway there, just to give you an idea. Then we have 8 cranial, 14 in the face. You have 3 bones in each ear, the ossicles, the auditory ossicles. Then we have the only bone in the body that doesn't articulate, meaning it doesn't form a joint with any other bone in the body. That's called the hyoid. It's in the throat. We have 1 sternum, 1 sacrum, and 1 coccygeal bone. So that's a little bit of a breakdown there. And what we're going to be focusing on today is what you see here in this picture. But it's not just going over these, knowing that this is the skull. It's knowing, the 50 to 75 different important landmarks of the skull. It's not just knowing this is the sternum. It's knowing this is the manubrium, this is the body, and this is the xiphoid process, right? So we'll go over all the different parts of the sternum. We'll go over the different parts of the rib. We will specifically go over how we differentiate between the cervical vertebrae, thoracic vertebrae, and lumbar vertebrae, because structurally they appear a little bit different. There are some unique features to each segment, but we'll go over the main parts of a vertebrae so you can identify the main parts. And then we'll go over the sacrum and coccyx as well. This is what it looks like from the posterior, right? We got some unique features to the skull, how the spine looks from the posterior, how the ribs, notice how the ribs attach to the thoracic vertebrae. That's important. And we use the ribs to help determine if there's a scoliosis, right? If there's any type of curvature of the thoracic spine, we can visibly see it in the rib cage because the ribs articulate with the spinal column from T1 to T12. There are 12 thoracic vertebrae. We'll go over the 5 lumbar, we'll go over the sacrum and the coccyx. There are some unique features to all of them. This is a little breakdown as to where the 14 facial bones come from and where the 8 cranial bones come from. And some of them are individual bones, like if you look at the occiput back here, that is 1 occiput. But then we have some bones that are paired. So like the parietal bone, you have 1 segment on this side of the skull. And then on the opposite side, which we can't see in this picture, on the right side, we have another parietal bone, so you get 2. Many of them are just 1, but the parietal and temporal are paired bones. And the same thing is true in the face when we look at the maxilla, the palatine, the nasal bones, the zygomatic bones. Many of these are paired. You can see 2. And then a few of them are just one bone that makes it up. Here's the hyoid bone. We only have one of those in the throat. And then we have 6 ossicles. We have the malleus, the incus, and the stapes. Those are 3 bones that are involved with your ability to hear, and 3 in each ear. So we have 6 ossicles. In another week, we will look at the appendicular skeleton, which is made up of 126 bones. And we'll go over these in a little bit more detail next week in another video. But to be familiar with them, right, the clavicle, which is the collarbone, you have the scapula, which some people call the shoulder blade. We have the arm, which is the humerus. We have the radius and the ulnar that are in the forearm. We have 8 carpal bones in each hand, so 16. We have 5 metacarpals in each hand, so there's 10. And we have 14 phalanges in each hand, so that's 28. Then in the pelvic girdle, we have the os coxa, or the coxal bone. We have 2 of them. The longest bone in the body, 2 femurs. A sesamoid bone, the patella, that's the kneecap, 2 of them. Then in the leg, right, we typically refer to this as the thigh. The femur is the thigh or the hip, but the leg is the tibia and the fibula, 2 bones that make up the leg. Each leg has 1 tibia and 1 fibula, so between both of them you have 2. There are 7 tarsals in each foot. Together we have 14. 5 metatarsals in each foot. 5 in each is 10. And then 14 phalanges in each foot. Altogether we have 28. Okay, so that's a little general introduction. When I come back to the next video, we'll talk about some of the external markings.